Gynecology in Turkey is highly sought after and in high demand by foreigners in need of medical care. Women deliberately go to Turkey to take advantage of the high-quality services of local gynecologists at affordable prices. Couples with fertility problems adjust their plans and schedules to undergo artificial insemination in Turkey and give birth to a child here. In this video, we'll discuss types of gynecological care in Turkey and their advantages, and we'll meet a doctor who performs these procedures in Antalya, Turkey. Subscribe, ask in comments. Here is all about medicine and treatment in Turkey. High-quality gynecological procedures, low prices, and the opportunity to combine treatment with relaxation in a pleasant climate. That's what attracts foreign patients to Turkey. To tell you about gynecology in Turkey, I met a doctor who has been treating women from other countries for many years.
Professor Işıl Kölelı, obstetrician-gynecologist with more than 20 years of experience, graduated from Ankara University. She has worked in a maternity and private hospitals in Istanbul, 2 years in a Urinary gynecology clinic in Dortmund, Germany, taught at the Department of Urogynecology and Reconstructive Pelvic Surgery at Incontinence University, author of an articles in serious international medical journals, opened an outpatient clinic in Antalya Education and Research Hospital, performs surgeries in ISO and JCI accredited international hospitals in Antalya, and sees patients in her own clinic, where she met me.
The population of Turkey is large, and doctors see many patients, so we have a lot of experience in the field of healthcare. Our hospitals are typically high quality, offering excellent treatment opportunities and professional development for doctors. I carry out procedures on my patients in hospitals that are accredited to international standards. Our operations are exceptional, and the nurses possess extensive experience. And I conduct the initial examination and perform straightforward operations in my clinic. This is my inspection cabinet. Here are our ultrasound machines, and here is our laser device. This is a 4-dimensional ultrasound machine that utilizes both an abdominal probe and a vaginal 4-dimensional probe for imaging. Not all clinics possess such a 4D device. With the assistance of this device, I'm able to assess the uterus in 4 dimensions. He provides very valuable information, especially for patients who have undergone in vitro fertilization. This is one of the rooms we utilize for our pregnant patients. Additionally, we transport our patients to this room for relaxation and rest after medical procedures are completed. This is our fetal Doppler. With the help of this device, we listen to the heartbeat of the embryo.
Like any true professional, Dr. Işıl Kölelı works only in selected areas of gynecology.
Her practice is divided into multiple segments. Each of them is narrow-focused. Therefore, we ask the doctor to provide more specific details about these areas. Gynecologists in their practice deal with a variety of diseases that affect women. Which diseases do you consider to be the most common in your practice? What are the things you most often come across? What are the topics that women most often ask you about? When we talk about gynecology and kosher, the immediate association that comes to mind is childbirth. Certainly, our women get married and a large number of them give birth. And all individuals have a preference for natural vaginal childbirth. But unfortunately, vaginal childbirth can have undesirable consequences. They can cause deformations of the female body, especially in the area of the genitals. After a natural childbirth, problems with sagging and urinary incontinence may occur due to damage to the muscle ligaments during the birthing process. A significant number of patients frequently come to our clinic seeking assistance for conditions such as urinary incontinence, bladder prolapse, openness in the genital area, vaginal stretching, weak vaginal muscle tone, as well as sexual problems or difficulties related to the appearance of the genitals. You specialize in treating urinary incontinence in women. How frequently does this disease occur? At what age does he most often manifest himself? And what percentage of women, in your opinion, suffer from urinary incontinence? Urinary incontinence affects every third woman aged 45 or older and every second woman aged 60 or older. It is a common condition that many women experience. First of all, after examining our patients, we determine what type of incontinence they have. Do all women who suffer from urinary incontinence need to be treated the same way? Or are there different approaches, different treatment methods? We categorize patients into 5 groups and provide distinct treatments for urinary incontinence in each group. Surgical intervention is often necessary for urinary incontinence. These can be so-called sling operations. We made a separate video about treating female urinary incontinence. The link is in the description of this video. Materials also an article on Healthy Turkey website. We also provide link to this article. And at meeting with Dr. Işıl Kölelı, we asked her to tell us about other areas of her work. One of the challenges you aid your patients in overcoming is the condition known as uterine fibroids. Please provide details on how often this ailment occurs and the potential consequences it can lead to in women if you may. Fibroids or myomas are found in about 25% of women who are 40 years old or older, occurring in every fourth woman. Fibroids have the potential to cause pain in the pelvic area, discomfort during sexual intercourse, heavy menstrual bleeding, or irregular bleeding episodes that deviate from the normal pattern. If fibroids grow excessively, they can exert pressure on the intestines and result in the occurrence of constipation. Fibroids can also hinder a woman from conceiving. Is it possible to eliminate uterine fibroids without surgery or any invasive procedures? Non-surgical methods of treating fibroids do exist, but they are not highly effective. For example, there is drug treatment for fibroids, but this medication has a very serious side effect in the form of osteoporosis, and after discontinuing the medication, the fibroid returns to its previous size. Therefore, we cannot use this method very often. Another non-surgical method of treating fibroids is the blocking of the blood vessels that supply the fibroids with a specially placed thrombus. Nevertheless, this can have an impact on the ovaries, leading to issues for females who are below the age of 45. Or there might be a potential risk of the clot migrating to other regions. Consequently, this technique has certain limitations. We can apply these treatment methods only to specific groups of patients. Therefore, in most cases, myoma is treated through surgery. We've also dedicated a separate video to removing uterine fibroids, which you can find in the description. And now let's ask the doctor about one of the most popular topics in gynecology. One of the aspects of your work is in vitro fertilization, which is commonly abbreviated as IVF in the medical field. I am aware that IVF is in high demand. What is the annual number of patients on whom you perform this procedure? We have a large number of patients who come to our facility for in vitro fertilization procedures on a regular basis. We perform these procedures on approximately 100 patients per month. This is about 1,000 per year. And most of our patients come from abroad. There are different assessments of the effectiveness of the IVF method. In certain sources, they discuss the efficiency of approximately 20%, while in other sources, the efficiency is reported to be around 50–60%. What is your assessment of the current effectiveness of the method of extracorporeal fertilization in terms of its outcomes? The effectiveness of in vitro fertilization can only be evaluated by dividing patients into different categories. Certainly, the efficacy of the procedure in a 25-year-old woman will not be identical to that in a 45-year-old woman. Various indicators are found in males. One individual has a low number of spermatozoa, while the other has a high number. Success is not identical for each of them. Generally, around 25% of couples are able to achieve the joy of having a child, indicating that a child is born to approximately a quarter of couples in general. This is the average efficiency of in vitro fertilization worldwide. Unfortunately, this particular indicator has remained unchanged over the course of the past 15 years. The success rate among younger patients is 40%, but it decreases to 15% among patients who are over the age of 40 years old. At this age, the emergency reserve, the follicular ovarian reserve, experiences a decrease. Please provide a simple explanation of the individuals who can benefit from the procedure of in vitro fertilization. What is the duration required for me to prepare for her? How does the procedure itself take place? And what should the patient do after the procedure? First of all, we thoroughly evaluate the man and woman who come to us for treatment. The history of the patient, the medications they utilize, the surgeries they have had, the diseases they have. All of this is extremely important to us. After consultation, we examine the patient's hormones on the 2nd to 3rd day of menstruation. We assess her ovaries using ultrasound. If needed, we capture an image of the uterus. We extract a sample of sperm from a man. Once all the required preparations have been completed, we initiate the procedure on the 2nd or 3rd day of menstruation. If the patient already possesses the required images, we can initiate the procedure on the same day subsequent to conducting the remaining examinations. The process of in vitro fertilization typically lasts for an average duration of 10 to 15 days. Our objective is for a woman to generate a large number of eggs. When there are a sufficient quantity of egg cells, we gather them. So, approximately 10 to 15 days after the initiation of the procedure, we retrieve the eggs. Subsequently, on the same day, we obtain sperm from the male partner, and then we combine the sperm and eggs in the laboratory with the aim of generating an embryo. When the embryo is 3 to 5 days old, we can transfer it to the patient. However, in some cases, we choose to freeze the embryo and introduce it at the most appropriate time during the nearest suitable segment of the menstrual cycle. When transferring embryos, we employ particular medications, and thanks to this, we can readily determine the specific day on which we will introduce the embryo. Research findings indicate that the use of medications to determine the day of transfer has proven to be highly successful. It is important to note that, based on research data, the transfer of embryos after freezing has a higher success rate compared to transfers made without freezing. This is far from all that Dr. Işıl Kölelı told us. We have a separate video on our channel about each direction mentioned in this video. On the website, you can read about them in a special article on gynecology in Turkey. Find the links in the video description. Don't forget to subscribe to the channel. The doctor has other areas of work. These are aesthetic procedures related to genital plastic surgery. They also frequently pique the interest of patients, including those from other countries. Turkish doctors have had a long and well-deserved reputation for excellence worldwide. There is a stable demand among foreigners in this country for gynecologist services, which are highly sought after. From which countries do patients usually come to you? We reside in Antalya, and here the population that speaks Russian is in the tens of thousands, so a significant number of our patients are Russian-speaking. We also have patients from Germany, predominantly Turks living in Germany. Additionally, we have patients from England and Egypt, and there is a group of patients from Turkmenistan, Tajikistan, as well as Azerbaijan. Many patients from Dubai and Saudi Arabia. People from these and other countries can get consultation from specialists at Healthy Turkey, which knows many doctors and clinics in different cities of Turkey, and based on the specifics of your situation, can find the most convenient and effective treatment option and other medical procedures. The video description includes procedure cost, reception, airport pickup, hotel accommodation, and language-speaking assistance. Turkey stands out from other countries with its comprehensive approach to patient care, where each procedure has to be paid for separately. The company Healthy Turkey, which works only with verified specialists in both medicine and hospitality, is responsible for organizing such an all-inclusive trip and coordinates all their work for each patient. Healthy Turkey takes care of everything, from consultation and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents, and even rest between doctor's appointments. The company's website address is on the screen. This site has a lot of information on other areas of health tourism. You can use it as a reference. Contact this number for consultation. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.